Did you know that 43,250 women suffer from cancer? According to the American Cancer Society, 287,850 new cases of invasive cancer will be diagnosed, and the most significant risk for getting breast cancer, which is 80% in most cases, is age. The older you are, the higher your risk. Did you know that living with cancer can be stressful? From the moment that you're diagnosed to the many treatments, while you, my busy mothers, have to keep up with the family, friends, your daily schedule, and other external needs. Despite the challenges you might be facing, my dear mom, do not give up. Always stay positive. Hello, everyone. Welcome back to my channel. Today, I'll be sharing with you information on breast cancer. It is most fitting to do a video on this topic since October is Breast Cancer Month. It's not easy to stay positive and upbeat during your time of stress. However, it's best to try and think positive thoughts at all times. This channel, Exclusive Gems for Busy Mothers, is always here for you to provide you with encouragement and to uplift your spirits, my dear busy moms. Never think you are alone. So stick with me as I provide you with information for you to meditate on. A cancer that forms in the cells of the breast, men are not much likely than women to develop breast cancer. The most common breast cancer symptoms are the lump in the breast, a bloody nipple discharge, and changes in the nipples or the breast form or the texture. The type of cancer being treated depends on the stage. Now, chemotherapy, radiation, and surgery might be used. A doctor can treat it, and the diagnosis is necessary. It is always a need to do imaging or lab tests. Breast cancer is a type of cancer that develops in the breast cells. The second most prevalent cancer in women to be diagnosed in the United States is breast cancer. Both men and women can develop breast cancer, but women are much more likely to do so, such as a substantial financing for breast cancer research, has been aided. They're trying to find ways to, develop on this therapy. Early indication is very good, and knowledge of the disease of breast cancer leads to a better survival rates because, the number of fatalities is reducing with modern technology. Some signs and symptoms are the lump in the breast and a thickening feel. The nipple changes. There's a change in the size and shape of your breast. There's changes in the skin around the breast area, such as dimpling. And there's a newly inverted nipple. There's peeling. There's scaling, crusting or flaking. There's pigmentation of the area surrounding the nipple. Redness or pitting is when the skin goes in. The skin can become orange. Make sure you go to see your doctor. Make an appointment to go if you feel a lump when you go to get a mammogram, or you feel something is not normal. The causes of the cancer is abnormal growth in the cancer cell in the breast, okay, and it multiplies. The unhealthy cell divide quickly, and they more than the healthy cells, and that's what causes the breast cancer. Typically it forms in the ducts that produce the milk, so that one is considered the invasive ductal carcinoma. And breast cancer can also start in other cells or tissues within the breast, including the glands or the lobes. Those are called invasive lobular carcinoma. The risk of breast cancer may be increased by hormonal behavior and environmental variables, according to research. However, it is unclear why some people with risk factors never get cancer, while others with risk factors do. There is inherited breast cancer, and doctors estimate that approximately 5 to 10% of breast cancers are related to gene mutation, meaning gene multiplication, right? Passed on by generation. No, or from your relatives, that is. A lot of the inherited genes, they grow, and the probability of getting the cancer is greater. The breast cancer gene is called the BRCA1. Now, if you have a relative with breast cancer, you have to seek medical attention to make sure that it gets suppressed, or they try to do the radiation and chemotherapy to reduce its spread. All right. Now, um, when it's genetic, you get some counseling. You can get counseling if you think you might be exposed to it. You should stay relatively fit with some exercise and everything. um, there are some decision making that you will have to do, my busy moms. Breast cancer threat, it's very serious, and it's very unfortunate when someone has to develop the breast cancer, because then it can be very life changing. It can be very, very life changing. And if you know you're exposed because of family to it, go and get early check, because early detection can be, good for you. Acknowledge that it might be hereditary, and go and seek treatment early. Okay, being a female, women, we are much likely than the men to develop it. And with increasing age, your risk of breast cancer increases with age. A personal history of breast condition, if you have a breast biopsy and found any kind of carcinoma, that might increase your risk of breast cancer. Personal history of breast cancer, if you had breast cancer in one breast, you will have an increased risk of developing cancer in the other breast. Now, like I said, with a family history of breast cancer, if your mother, sister, daughter, whoever of a particular age, they're at risk of breast cancer, it is gonna increase, right? Because you've inherited the gene that can increase the risk for getting the cancer mutation cells. Um, these genes can increase the risk of breast cancer in your body, but they may not make cancer inevitable. Now, radiation exposure, if you have received radiation treatment to your chest as a child or adult, your risk of breast cancer is increased. Obesity, being obese, increases the risk of breast cancer. Beginning your period at a young age, before 12, increases the risk of breast cancer. Beginning menopause at an older age, if you began menopause older, you may likely develop breast cancer too. Have your first child at a late age in life can increase the risk. Like I said, these can increase the risk. You don't necessarily have to have it. Having never been pregnant, you know, some of these women, because their breasts have the mass formation, having never been pregnant, you could be exposed to the risk of breast cancer. Postmenopausal hormones, when you combine the estrogen and progesterone, you know, when you're going into menopause, you can have a risk for breast cancer as well. Now, if you're experiencing it, like I said, stick to your regimen of your diet and also your medical attention. You have to make changes in your life that may reduce, help to reduce the possibility of the breast cancer. You can ask your doctor about screening options for you, and discuss it with your medical providers, because most breast cancer screening assessment and tests, including breast assessments and mammograms, talk to your doctor about that. Make sure you're doing your yearly checkups, because, the dangers of not getting screened is high. You can determine, breast cancer screening techniques which are proper for you. Become familiar with your breast through the breast self exam, for holding up your hand and feeling around your chest, just to make sure you don't feel any lumps. Okay. um you might be able to help yourself by doing the regular checks outside of your regular screening appointments. It is very imperative, my busy mothers, that you find that time to do your self examinations and be aware of your bodily changes. If you see any uncommon symptoms or signs in your breast, go immediately to the healthcare provider. Okay, they can assist you to comprehend, to understand what is going on, what is changing in your body. You be aware of your body, so when there's any change, you can go to them. If you drink alcohol, you have to do so in moderation. Limit the amount of alcohol you drink, to 1 drink per day. Make sure that you're exercising most of the week. Aim for at least 30 minutes of exercise most day of the week. If you haven't been active lately, you should try to get in at least 30 minutes daily. Okay. Limit postmenopausal hormone therapy if you can. A combination of hormone remedy can also boom the threat of breast cancers. Talk with your doctor to see what medication you're using and if it will aggravate or cause the cancer cells to become aggressive, right? um like I said, the signs and symptoms, the lump in the breast is one of the most prevalent ones. So make sure don't leave any lumps in your breast unchecked. Go get it checked out. Never think it was this or it was that, right? Lessen the threat of breast cancer, right? Make sure that you are doing your yearly checkups and your personal checkups and all your lab works, especially if our family members have it. You have to maintain a healthy weight as well. Your weight must be healthy in the terms of lose weight if you know you have on too much weight. Reduce the number of calories you eat each day to increase slowly increase the amount of exercise. Choose a healthy diet. you know Women who try to eat healthy, it tends to help them more reducing the risk of breast cancer. Okay. The Mediterranean diet is one of the diets that people use often, and it's mostly plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow this diet choose healthy fats such as olive oil over butter and fish instead of red meat, because they say red meat gives you a higher chance when you're at risk for breast cancer. So reduce or eliminate red meat from your food group. Now, um, my busy moms, I applaud those of you going through the situation at this time, you know because I know it can be daunting, but just take heart and speak with other groups to motivate yourself. Get encouragement from your church group or other cancer survival groups. If you need somebody to talk to, or if you have a very good friend that you can sit and express yourself to. Do not become scared of these medical words that I'm reading to you, speaking to you about, because if you do not comprehend, just go back and watch the video and research these medical jargon, because some of these medications may when you go to your doctor, know what you're getting, because some of these medication you want to know what side effects they might have. Ask your provider if you're you know what are the benefits and risks for taking some of the medication that you might be having to take. There are also preventative surgery. Women with a high risk of breast cancer may choose to have their healthy breasts surgically removed, which is called prophylactic mastectomy. Prophylactic mastectomy, removing your breasts. And they may also choose to have their healthy ovaries removed, which is called prophylactic oophorectomy, to reduce the risk of, the breast cancer and the ovarian cancer. Now, we stand by all you mothers out there that have gone through this dreaded disease, and those of you who are still going through this disease. I totally sympathize with you. I do hope they will find the best treatment to eradicate this disease. As you can see, I'm wearing pink to show my full support for you, survivors of this cancer, and those who are going through it. Thanks for stopping by and viewing my channel. Please like, subscribe, share, and leave a comment below. I invite you to join me when I upload another video for you busy mothers out there. Hit the notification bell so that you will know when I upload another video. Check the link in the description box below to see another one of my awesome videos. And for you, my rock stars that are surviving the cancer, keep up the good fight. I am rocking with you. I totally support you. I have family members who have passed away from this dreaded disease. I have friends who have passed away from this disease. I have people that have survived, and I know it can be very, very challenging time in your life, especially you busy mothers who have to do it with your children schedule and your schedule and the scheduling of the home. It's never easy. But like I said, my channel is here to support you and to make sure that I provide you with information in various aspects of your life that can uplift you, edify you, entertain you, and inform you. So until next time. Bye.